Hi, my name is Dr. Nasser Razack. I'm a neurointerventional surgeon. I specialize in treating stroke and other vascular disorders in the brain, such as aneurysms. There's two different types of stroke a person could have. One is called an ischemic stroke when a blood vessel is occluded, and one is called a hemorrhagic stroke when a blood vessel ruptures or leaks. In both forms of stroke, the brain is deprived of oxygen and nutrients to a certain part of the brain. That area of the brain that's deprived of oxygen and nutrients becomes symptomatic. So if you don't have oxygen going to the part of your brain controlling your arm, you'll have arm weakness. So most strokes are ischemic strokes caused by a occluded blood vessel in the brain. In fact, the most deadliest forms of stroke that we treat here at Physicians Regional Hospital are what we call large vessel occlusion strokes. As a comprehensive stroke care center, we are able to treat that type of stroke 24/7, as opposed to most hospitals that cannot treat this form of stroke, which is the deadliest form of stroke. There are certain things that can trigger a stroke. Blood pressure by far is the highest risk factor for stroke. So if you have high blood pressure, you have to get that under control. When I say under control, it has to be less than 120/80. So when a stroke occurs, specifically a ischemic stroke, a blood vessel in the brain is blocked. When that blood vessel is blocked, it cannot supply oxygen to that part of the brain. We have to open up that blood vessel as soon as possible to resupply oxygen to that area of the brain. All the signs and symptoms of stroke are related to the suddenness of how these symptoms occur. Think about it. If you have lack of blood supply to the brain and oxygen to the brain, these symptoms occur just like that. So if you remember the mnemonic, be fast, it helps you remember these symptoms. B is for balance, E is for eyesight, F is for facial asymmetry, A is for arm weakness, S is for speech disturbances, and T is for time. So if you see any of those changes in balance, vision, facial asymmetry, arm weakness, speech disturbances, dial 911 immediately. Here at Physicians Regional Hospital, and actually all of Collier County, our EMS system uses a mnemonic called MANGO. And what MANGO is a mnemonic to identify a large vessel occlusion. M stands for motor weakness, A stands for aphasia, which is a fancy doctor word for speech problems. N stands for neglect, which is a fancy doctor word for not being able to feel something on one side of your body. G stands for gaze preference, or which way your eyes look. And O stands for an occipital defect or problems with vision. So why do we use this tool? This tool allows our first responders, EMS, to go to a scene and determine if someone has a large vessel occlusion, that deadlier form of stroke, and bring them to a hospital like Physicians Regional where they be treated immediately. If you or someone you know are having a stroke and you've called 911 and EMS is on the way, the best thing you could possibly do is make that person comfortable. If you can, the best thing you could really do is just lay them flat on their back if you could do so comfortably. If you lay them flat on their back, it'll allow blood flow to the brain to be delivered easier. One thing we don't want to do is if you or someone is having a stroke, you don't want to give them a baby aspirin. I hear all the time people are like, should we just give aspirin? Remember we said there's two forms of stroke. There's a form of stroke that is caused by a occluded blood vessel. Aspirin could potentially help with that, but there's also a form of stroke caused by a ruptured blood vessel. So if you have that form of stroke, you don't want to give aspirin because that could make that form of stroke worse. Once we determine a person has a stroke and they come to the hospital, we do imaging studies to find out what blood vessel in the brain is involved with that stroke. We take them up into our laboratory facility, prep the patient, go inside the blood vessels, and again, we do this endovascularly, which means we go through existing blood vessels of the body, typically through a blood vessel in your leg, almost like a cardiac catheterization, but instead of going to the heart, we go up into the brain. We find that occluded blood vessel and we open it up with different surgical devices. The two types of devices we use are what are called stent retrievers, which are basically like a stent-like device that's able to capture that clot. The other device we use is something called an aspiration catheter, which is a fancy term for a vacuum cleaner. We basically just put that catheter in front of that clot and suck it out. Here at Physicians Regional Hospital, we are a comprehensive stroke care center, which means we could take care of any type of stroke 24/7, as opposed to a primary stroke care center, which cannot take care of large vessel occlusion stroke. That's important because large vessel occlusion stroke, these occluded larger blood vessels in the brain, are a huge problem. Why? because they account for 90% of societal cause of all stroke. They account for 80% of poor functional outcome, and they account for all ischemic stroke related death. So if you look at that group of stroke, that large vessel occlusion stroke, it only consists of about 10 to 30% of all of ischemic stroke, but it's the deadliest form of stroke. So that's the form of stroke we have to treat as quickly as possible, and that's precisely what we're structured to do here at Physicians Regional Hospital. So if you or someone you know are having a stroke, it's very important to seek medical attention as quickly as possible. Believe it or not, almost 2 million brain cells can die every minute in certain types of stroke. So if you or someone you know is having a stroke, you must dial 911 immediately. If you or someone you know are having a stroke, you have to seek medical attention immediately. If you don't, that area of the brain that's deprived of oxygen could continue to increase in size, meaning your stroke size will get worse. And as that stroke gets bigger, involves more parts of your brain, the chances of that causing a bleed in your brain increase. So bleeding related to stroke is directly related to the size of the stroke. So it's very important to come to the hospital as soon as possible and get that treated, not only to restore that brain function, but to reduce the chances of having a bleed in that stroke. After a stroke, a patient's outcome, of course, depends on what part of the brain was involved. However, one thing that we do know in our field is these large vessel occlusions, if they're treated quickly and appropriately, their response or their outcome can be very, very good. We've had several very good outcomes as long as the patient comes to the hospital soon enough. In order to prevent a stroke, there's a lot of dietary and lifestyle changes we can make, and they could actually be remembered by the mnemonic B FAST also. So B is for blood pressure and blood sugar. It's very important to try to reduce your blood pressure and your blood sugar. E is for exercise. Exercise is a great way to prevent stroke, particularly walking. F is for fats. It's very important to reduce your consumption of animal fat in the diet and reduce the percentage of fat in your body. A is for AFib. AFib is an irregular heartbeat. When you go to your physician, you have to ensure you don't have AFib. If you do, you could be put on certain types of drugs, certain types of blood thinners that could prevent a stroke. S is for smoking. If you smoke, you got to stop smoking. And T is to trim your waistline. Why is this so important? Well, it's very important to make sure that your waistline, the circumference of your waist, is 1/2 or less than your height. If you could do those things, you can prevent stroke.